Hi.
Good morning, everyone. Well, no, it's morning here still for me and Morgan, but for Kelly, it's lunchtime.
We're
So,
just touching the afternoon.
yes. Hello, Alejandra. Hi, Amanda. Hi, Amy. Hi, Angela.
Look at all the
Hi,
people. Hi,
Britt.
everybody.
Britt, do we miss everybody already? Hi, Cassidy.
It's so fun knowing like faces to the names we see in here now. Like they're not just names anymore. I'm like, oh, I can see you in my head.
Yeah.
Oh, I see
Hi,
Rebecca's from
Danielle.
PA. Oh, Rosemary is also from PA. Where are you guys coming from in PA? I'm right outside of Philly, like 15
Mm.
minutes from Philly, Jersey, and Delaware. Oh, Alejandra said gorgeous ladies. What, how nice.
Oh, hi, Crystal.
Warrior Town. Okay,
Hi,
near Pottstown,
Marion.
not too far. Okay, Westchester's very close, but now you're in Scranton. That's about 3 hours now. All right, ladies, but all very Pottstown and Westchester, so right in this Delaware County area.
Mm-hmm.
Got some New Jersey
Yes.
in the house. Iowa,
Ripping
Sandra and I.
strips and popping zits is in here. My favorite name ever.
Ripping strips, popping zits. Okay. Hair on point. Amanda, thank you so much because I don't know. I know, Amanda, you follow me. I don't know if you know what's been going on, but this hair was hard to pull off today. But thank you. Also, I blow dried it different than the retreat.
It
I did.
looks good.
Yeah. So, oh, yes, you wrote me a beautiful message. Actually, yours was one of the most beautiful. Thank you, Amanda. All right.
Oh,
Anyway,
'cause she's that girl.
she is. It was very, some
Ripping
messages you
strips,
never know what
popping
to say,
zits.
but it was good. It was the perfect thing to say. All right. Well, we're here to talk about nanotechnology and
Of
sensitive skin today.
California.
Oh, yeah. We
And
got the whole US.
we got the whole gamut. It's raining here in Washington right now at my house. I don't
The
know,
sun is
Marianne, if it's
shining.
raining in Seattle today,
The sun is
but we're
shining
the
over here.
closest. No rain. Good for you.
Yeah.
It's only supposed to last a couple hours. It'll be okay.
Is it always rainy?
Not always. We're kind of
Okay.
in a pocket out here in Port Angeles, so it's not always, but it's you know, it doesn't.
Yeah.
Like at the retreat, it rained the one day.
Hmm.
I was like,
But it was
oh,
gorgeous the rest of the time
yeah, it
from
was.
all
It
the
was good.
pictures.
Shauna, you're a little bit quiet on my end. Can you project or turn up your mic or something?
Listen, I'm tired, okay? I'm tired.
I need you to yell.
Melanie's from Puerto Rico. Oh,
Can you hear
Vanessa.
me now, Morgan? Is it okay now?
Kind of the same.
Kind of the same. Where's my speaker?
Try something for me. I should
What?
have caught that in the test.
From
Do you
San
see the
Diego.
little up arrow next to where it says audio? Can you click audio settings and turn up your input volume?
Morgan is so smart.
I've
Like
just been on
what?
a computer since I was like 3 years old, and so people think I'm smart, but I'm
I
actually
mean,
just an iPad.
I thought I was. I
How
thought I
about now?
thought I did. I thought I did that. Like maybe not three, but like
I'm just an iPad baby.
10, maybe 10. You're an iPad baby?
And here's
Yeah,
high.
good. That's much better.
Better?
Yep, perfect. No, I was
Well,
like an iPad baby before there were iPads. I was like playing the Fisher Price game on my computer when I was a kid.
Oh, okay, okay. I remember the first game we had was like this weird SpongeBob game where you would like
Yeah.
catch the jellyfish. I
Yes.
loved it. Yeah, it was
Love it.
amazing.
That's all today's webinar is about. We're actually just reminiscing.
Just go through some nostalgia. All right.
okay, we have lots of people in here.
All right. Should I share my screen? Oh, but it's not turned on.
Yeah.
When it's first.
Okay, first of all, we are here with Kelly Conlan today of Rezenerate. It's my favorite infusion device, the one that Hale and Hush. We do a lot of partnerships. Kelly also is a dear friend of mine. She just spoke at my Awaken Aesthetics retreat. She was
An honor.
phenomenal. She cracked us up. I think one of the best and funnest speakers.
They put a
So
microphone stand there just so I would run into it. It was really rude.
I hope she cracks some good ones today. Makes us all laugh. But we're going to have Kelly talk a little bit about the nanotechnology and using it with sensitive skin on certain skin conditions. And then I will step in and talk about the Hale and Hush products that work. And then we have many protocols actually with Rezenerate, but we were going to go over the latest one. Hi, Shirley. Shirley's in there.
Hi, Shirley.
So anyway, phenomenal speech.
Amanda, she's too nice to me.
No, it's true. Okay, so if you guys have questions, please put them in the actual question and answer box so they don't get lost in the chat. You guys are welcome to chat away and do whatever you want, but please, if it's a real question, put it in the question and answer so I can separate it. And I will get those questions to Kelly if it's pertinent to what she's saying or maybe at the end. So just hang tight and we'll answer all the questions. And then, of course, today, you guys know there'll be some giveaways because there always is, and it's always fun and exciting. Man, I felt like we haven't done a webinar in a long time. It was kind of later in the month this time. So anyway,
Have you?
it's
I've been
been a
doing
while.
I got off July because we did that, like the replay, the recap. So
Yeah,
I'm
yeah,
breaking July, but this is my third, I think, for
yeah.
August. So,
Well,
just going strong. Just going strong.
all right.
All right, well, let's dive in. Let's dive
Hey, get
in.
it, Kelly.
I'm gonna go ahead. So I always like to talk about the stratum corneum first before I dive into nanotechnology, but we're probably going to hang out in the stratum corneum talk for a little bit because I think it makes sense as we kind of discuss a lot of the different sensitive skin conditions. And if there's something that we want to utilize nanotechnology to help improve that condition, or if it's something that may be not as beneficial if we incorporate it. So first, just talking about the stratum corneum, of course, we know it is our first line of defense. It's the two-way waterproof barrier that is going to limit that passage of fluid and electrolytes from our all of our tissues and from being kind of donated or given to the outside environment, right? So it's keeping everything inside and including our water, and it's keeping all the bad things out. So we're not getting any entry of harmful chemicals and toxins. Really helps to limit that. But of course, with that, it's also going to limit the absorption of our ingredients. And when we think about sensitive skin, a lot of times we know that the function of the stratum corneum is a bit disabled or disrupted. And sometimes that can not be a great thing when we're thinking about nanotechnology. So most importantly, we just want to understand that the basic function of that stratum corneum is to keep all of our fluids, electrolytes, and waters inside and prevent the entry of those harmful toxins and chemicals. And then that negative side effect is, of course, it keeps out all of our goodies, all of our good ingredients, specifically some of the ones that we love from Hale and Hush. So there's a concept with nanotechnology that is really important, and that's percutaneous absorption, or PA. So that really refers to the amount of substance that's going to pass through the stratum corneum compared to the amount that we actually apply to the stratum corneum. And this is a depressing number because we invest a lot in our skincare. So to know that when we apply that skincare topically just alone, we're only getting about 2 to 10% of that absorbed past the stratum corneum. If it is sitting on the surface, if it's getting evaporated, if it's getting wiped off, it's not interacting with the living tissues to create any changes within the skin. So it's being wasted, that 98 to 90% of product that we are applying. So it's really awful. And if you really think about it, like you're not even getting 100% you pump out of the bottle because some staying on the gloves. And so let's not depress ourselves too much. But really, a small amount of that product that we're applying is able to get into those active layers and create the clinical change that we're looking for within the skin and the body. So if the ingredients are not able to get in, they're not able to be effective and create that change that we're looking for. And that is going to produce that desired results that our clients have chatted with us about. So thinking about the stratum corneum, there's a lot of changes that can happen in the stratum corneum and a lot of things that can kind of lead to sensitive skin or maybe a symptom of a sensitive skin condition. So some of those things that I wanted to call out are going to be increased transepidermal water loss. This is something we talk about frequently, I think, within the skincare realm. But we know that that is when our water content or is being basically kind of moving from the lower levels, the lower tissues. So thinking about it going from the dermis up to the epidermis and then being evaporated or kind of wiped off the surface of the skin. It's basically us just giving away, right, our precious water to the environment. And so if we can't hold on to that water content, there's a lot of issues that can occur within the skin, right? I mean, just thinking off the top of my head, our natural desquamation process really depends on having a good hydration content within the skin. So if we have a water imbalance within the skin, we're not able to properly turn over our skin cells. That's going to lead to a buildup of those dead skin cells and start to impair the other functions of the skin. So with that, it is really important that we manage that hydration and that water content. And so if we're experiencing transepidermal water loss, obviously that's really negative. And with that, we can also start to experience an intolerance of some of the products that we apply as well. And Shauna, interject here at any time if you have anything to say. Some other things that I think are important to note is when they tested sensitive skin, which is actually, as I was finding, a lot more prevalent than I realized. I think, of course, we know our standard sensitive skin conditions, right? We know when somebody comes in and they're presenting with rosacea, but a lot of our clients don't really have a super visible a super visible flag, a red flag waving that they have sensitive skin, but they'll come in, they'll lay down on our treatment table and we'll talk about, do you have any sensitivities? Do you have any allergies? And a lot of times they'll say, yeah, I have sensitive skin. And we have to dive into why do they think they have sensitive skin? And two, do they really have sensitive skin? But in my research, I have found that it is a lot more prevalent than I realized, like sometimes over 50% into the 60%. So that was a statistic that really shocked me. But anyway, sensitive skin that was tested in some of these research reports that I was reading reported a decrease in ceramide levels, right? So ceramide is going to ceramides are going to comprise, I think, over 50% of our natural skin barrier. So they really are one of the main components of that lipid matrix, right? So really important in managing our overall skin barrier health and just the skin health in general. So a lot of our sensitive skin clients, as they come in, we can start to immediately think about their ceramide levels and things like that. Another issue that is a change in the stratum corneum is going to be a thinning of that corneal layer. So what that does is actually increase skin permeability, but in a negative way. And because of that increase in permeability, we start to see an increased release of those inflammatory mediators, right? The cytokines and things like that, which is not helpful. A lot of times, inflammation, of course, is a basis for many of these sensitive skin. I see Shauna's mic going off, and I'm ready to hear what she has to say.
No, you're totally right. And this, it's funny when you said thinning of the corneal layer, I think of so many things. Like this is issues with the microbiome. It's the barrier function isn't working properly. It is menopausal skin, which we talk about all the time, that now has changed because of hormone levels. This can go on and on. So this is the key, I think, to the sensitive and sensitized skin is that thinning of the corneal layer. So that's a good point. And then of course your skin tries to protect itself and then releases all the inflammatory mediators. And that's where you get redness, uncomfortability, even tenderness, all this stuff happens now.
Everything, when I am talking to my clients who have sensitive skin, I'm always talking about inflammation and that
Yeah.
it really is a basis. And it's something that we're really going to have to manage in whether, no matter what it is that they're presenting sensitive with, we're going to have to talk about kind of managing that inflammation because sometimes it's overproduced and that's when it starts to become unhealthy and more damaging. And that happens pretty often. So we have to
Or like certain skin conditions, it becomes acute. Like it's constantly inflamed, like rosacea, psoriasis, eczema, acne sometimes, those kind of things. So sorry, Kelly, wonderful point.
I love when it's not just me up here. I met so many people. They're like, I saw you on the webinar. I'm like, it's so good. It's so good to know that you're there because I can't see you. And it's so odd, right? Like opposed to doing the live in-person class. I miss people. I miss seeing the faces. So I'm glad I at
Yeah.
least get to see Shauna and Morgan today.
Yeah.
And then the other thing that I wanted to highlight was pH imbalance. So, of course, if the pH is imbalanced, the skin is really vulnerable, and that can be to bacteria, and it can also be to other symptoms such as dryness, right, redness, and irritation, and things like that. So, a lot of things that we really want to manage. And as we know, there is really many different sensitive skin conditions. I was trying actually to get a comprehensive list together, and then that really just, right? It became very overwhelming. Even
Well,
with,
we only have an hour, so
and
that
I
could
was
have
like,
been
yeah, settle down, Kelly. We only
20 hours of class. Yeah.
But I thought maybe if I could get like a nice little categorized list or something, it would be good. But what it came down to as I was looking at all these different sensitive skin conditions and then thinking about is nanotechnology really going to benefit this condition? It came down to these three things that I was thinking of, which was causes, severity, and symptoms, right? So when we're thinking about causes of sensitive skin, chemotherapy, right? Could be a cause of sensitive skin. And if that's the cause, we're really not going to be working with nanotechnology in that situation. Um, Accutane, right? Accutane use could be the cause of a sensitive skin, could cause a compromised barrier. And so that's going to create a big time, a big gap in from when that client stops the Accutane to when we can really start to incorporate nanotechnology into their treatment, maybe even up to a year. So it really is important to consider the cause of the sensitive skin. But the good news is there is a lot of sensitive skin conditions that we can treat. So when we're thinking about some causes that we're still able to work with nanotechnology, thinking about some vascular issues, right? It's really okay for us to still work with like a mild or moderate rosacea. And we're going to figure out why. You know what? Actually, I'm going to come back to this slide. I'm going to do the nanotechnology. I'm going to come back to this slide. Keep this in mind. Let's talk about nanotechnology, and I think we'll wrap back to that. So what is nanotechnology? This definition sucks, but it's going to make sense in the next slide. It's really awful. But what it is science, engineering, and technology conducted at 1 to 100 nanometers on the nanoscale. I don't know what this little thing is here. We don't really come in, we're not really familiar with the nanoscale. It's not something that we can see visually. It's naked. It's not naked. It might be dressed, but it's invisible to the naked eye. So it's really hard for us to quantify or even understand the size. So I see that was a truly honest mistake, you guys. Okay. So thinking about the size, 1 millimeter is comprised of 1 million nanometers. So when we're thinking about microneedling, measured usually like, or microchanneling, 0.25 millimeters up to 3 millimeters, and we're thinking about nanotechnology at 1 to 100 nanometers, it's really significantly different knowing that 1 million nanometers is only going to be the equivalent of 1 millimeter. If you are familiar with a ruler, you can picture an inch and kind of segregate that off. 1/32 of an inch. So you can divide that inch by 32, 1/32 of that inch, and then divide that by a million. And that is going to be a nanometer. So super, super small. This chart gives us a little bit of help. So we can see we have the atom there. It's actually on the subatomic scale. So even below nanometers at 0.2 nanometers in size. And then we have our molecules and our small viruses, which are going to be around or average in 2 nanometers to 20 nanometers in size. We have our Rezenerate True Blue tip right in between there. And hopefully you can see there is a little square on that blue core, and that is a 99% monocrystalline silicon chip. On that chip, there is a series of pyramids, and each of those pyramids are going to be between the size of a molecule and the virus, so between the size of 2 and 20 nanometers. And what does that mean? That means that it's only working within the stratum corneum, right? It's not interacting with any other layers of the epidermis. It's just working with that first layer, the stratum corneum. A lot of time we get asked about depth. But as you can see with these measurements, it's almost impossible to understand. So just know that we are really just working within that first layer. And the goal with that is really to just disrupt the waterproof function of the skin for a short period. We talked about transepidermal water loss a few slides ago. It's obviously something that's negative. We don't want that. So with this, we really want to limit that skin's that waterproof disruption for that 20-minute period. So we can get in all of the nutrients that are going to be beneficial for the skin and then get that barrier sealed back up so that the skin can hold on to all of those goodies as well as its water and hydration content as well. So with that, that's what we're going to be doing, just working on the stratum corneum to disrupt that waterproof function for about 20 minutes. And then looking at this chart, visually, the next thing we have that we can compare to is going to be a strand of hair. So super small, but about 80,000 nanometers in size. So still much larger than those pyramids that are going to be found on the surface of the true blue tip. And then for microneedling services, those individual needles are usually about 100,000 nanometers plus in size, and that's going to be on the smallest size. So this is a picture of the tip enlarged. You can see all those pyramids all over the surface. As the tip oscillates on the skin, it's going to create channels within the stratum corneum. Those channels are present for that 15 to 20-minute period, and that's what allows that waterproof function to be disarmed for that period of time. During that time, we're increasing that percutaneous absorption rate from 2 to 10% to 40 to 50%. So dramatically increasing the dose of the products that the client is receiving compared to if they were just receiving the treatment with topical products only. So this is just basically a visual of that. We're, again, just disrupting that waterproof function for that 15 to 20-minute window to increase that absorption from 2 to 10% to 40 to 50%. It is a product neutral device, so you're going to select those serums or actives that are best for your clients. And whatever you're applying immediately before, during, and within that 20-minute window is what's going to benefit from that increased absorption rate. So those serums that we apply, the slip and glide that we use during the treatment, and any masks that we would apply afterwards. How we explain this to clients is basically just that their skin is a barrier. And so we're going to trick it into acting like a sponge for about 20 minutes so it really gets as much product as it can. And that's just going to help them get a result faster with less treatments and super comfortably. And one thing that's really great to know is once we have those ingredients transported across the stratum corneum, there really is no further barrier. So they can really move about the skin as the body needs them and get to where they need to go. So with nanotechnology, we're going to be producing immediate results and long-term results. And the immediate results are really going to come from the treatment itself. So we're increasing circulation, we're providing tension relief. That's really going to be from the acupressure, from the cold therapy massage with the nanoglobes. And then we're instantly plumping skin with the hyaluronic acid that we're infusing and the vibratory facial massage. When we think about sensitive skin and, just skin health in general, obviously the water content, like I mentioned, is super important. So using a hyaluronic acid as a slip and glide is going to be really supportive to the skin. We have our natural moisturizing factors that are doing their job internally to kind of regulate the water content of the stratum corneum. But by infusing a hyaluronic acid, which can hold 1,000 times its weight in water, it's really going to support that natural moisturizing factor and allow us to really get some moisture within the skin during that treatment. We use that very liberally during the infusion process. So it's a wonderful way to really increase that hydration, but also super important to mention that we do really need to seal that in. So we don't want to just typically apply hyaluronic acid on its own. I like to make sure the skin is a little hydrated because it does need to draw water as well. So I like to have a little bit of moisture, a little water on the skin, but when I apply the hyaluronic acid, or another serum is also fine. And then, of course, at the end of treatment, I really love to use something that's occlusive and emollient to really help to support that barrier. And it's something that we briefly mention when we talk about Rezenerate, but it is something that I think is really important, and it is finishing that treatment with those emollient and occlusive ingredients because we are going to seal those channels. The body is going to heal those small channels within the stratum corneum in that 20-minute period, but we really want to support that lipid barrier as well and just make sure we are replenishing that with some really nice occlusive ingredients at the end of that treatment. Really just help to seal everything in. So the long-term results are really going to be based on the serums that we're applying, the masks that we're using. And so if we're working with sensitive skin, we really have to be mindful of those sensitivities, the allergies, and things like that, because we don't want to penetrate those at any higher of a rate. So we are going to be delivering those nutrients really very comfortably. And even for sensitive or sensitized skin, this still is a really comfortable treatment. And we can treat the lips, the eyes, neck, hands, décolleté, intimate areas. So we'll able to go over the brow bone, up to the lash line, and into those sensitive areas as well. We talked a little bit earlier about how managing the water content of the skin really helps to support the cell's natural desquamation process, and that is true within the infusion, but we don't consider ourselves really an exfoliant. So we do support natural cell desquamation and cell turnover, but exfoliation is still something that you'll be able to add into your infusion treatment to really accelerate those results and get the best end result for your client. So thinking about microneedling and nanotechnology, you can see here that we have the 3 blue pyramids. They are going to be representative of the true blue tip, and you can see they're really just working within the stratum corneum of the epidermis, not going any deeper. With microneedling, that's going to create a wound cascade. So even if we're working at a shallower depth like we would with microchanneling, we're still going to be creating a little bit of a controlled injury that's going to simulate that collagen and elastin process and generate that wound cascade that we're looking for. So through that injury and healing process, the collagen and elastin will be stimulated, and that is really what's going to help to contribute to the cosmetic result that we're looking for with microneedling. Where with Rezenerate, it's really just about getting a higher delivery of the topicals that we're applying. So we're not going to be looking for any collagen induction, and we're not really delivering any controlled injury to the skin. It's more of just that disruption or disarming of the waterproof barrier. So I'm going to skip over a lot of the pillars. Just know that Rezenerate is really safe for all Fitzpatrick's types as well as certain skin conditions. When you're thinking about what you want to infuse, this is going to be really helpful. Most of the time with sensitive skin, we're going to be working with our optimal choice serums. And a lot of times when we're starting to incorporate nanotechnology into our client's treatment program. If they are somebody with sensitive skin, we may only be using a hyaluronic acid to start. We might not want to introduce a lot of different variables for them in the beginning and kind of just work very conservatively to see what their response is before we overwhelm them with with maybe too many products or something that's a little too aggressive. So typically with the sensitive skin type, of course, we'll do our cleansing. We may skip exfoliation, especially if they're somebody who tends to be pretty reactive. If we feel like maybe we can add a gentle exfoliation, it's probably going to be an enzyme. And then we'll probably use just a hyaluronic acid or something that is very calming, a nice calming serum to infuse and see how they do with that before we get any crazier. But when we're working with clients who have non-sensitive skin or less reactive skin, we can choose from these 2 columns. So our optimal choice categories, like I said, are going to be our safe choice for everyone. We're especially for sensitive skin, but these are going to be products that we can feel pretty confident to use for almost anyone. The list is pretty exhaustive, so I usually give 3 questions to kind of help determine if the serum is a good serum for you to use. And the first question is, does it contain any acids, like AHAs and BHAs, not necessarily azelaics or tranexamics, but does it contain any AHAs and BHAs? If it does, it doesn't automatically exclude them, but it's pretty close to being excluded. I would follow up with where is that ingredient, if there is an AHA or BHA, where is that in the ingredient list? If it's like the last ingredient or second to last of a pretty long ingredient list, it might be okay. It's probably in there at a really small amount. But if you want to be really cautious and conservative, if it has any of those AHAs and BHAs, I would say not optimal. Um, when the client applies it to their skin, do they feel any sensation? And this is used alone. So in treatment room, if they apply it by itself, how does it feel? If they're using it at home, does it have any sensation? If it does have any tingling, burning, I would say no, it's not an optimal choice serum. And then the third question is it something that's available in back bar and retail? And if it's something that's only available in your back bar, then no, it's probably not an optimal choice serum. It's probably more on the corrective side. So other things to be really cautious of, especially with sensitive skin, is going to be pH, percentage of the acid serums, and also the molecular weights of those acids, which we're not really going to be using acids. So let's just focus on the pH, right? We talked about earlier how pH is really important to managing sensitive skin, and it can create a lot of vulnerabilities in skin if it's out of balance. So we really don't want to work with serums that are going to be super low or super high in pH. We're typically around the 4.5 pH area. If somebody has sensitive skin, it's probably great to stick right within there. Somebody who is a little bit more resilient might be able to dance a little bit outside of that pH zone. And then I'm not going to go into devices. Let's go all the way back to this slide, to the consideration slide. So now we learned a little bit more about nanotechnology, right? We understand that it does disrupt the stratum corneum temporarily. So when we're thinking about our sensitive skin, if it is already suffering from a barrier that's severely compromised, it's not going to be a great idea to incorporate Regenerate. They're not going to be able to repair that barrier, which is really essential, right? We talked about that infusion period being limited to the 15 to 20 minutes, and that's really essential for the skin's health. If somebody is already having a compromised barrier where they're experiencing a high level of transepidermal water loss, as well as a lot of sensitivity, there's no benefit to further disrupting that barrier to infuse any ingredients. So we have to be really careful because there are some sensitive skin conditions that we can treat. I talked about the mild to moderate rosacea. It can be really benefit to get a good delivery of some of those soothing ingredients that are really going to support the vascularity of the skin. It can be really beneficial to get some of that infused. Rosacea is not going to be a great candidate for other treatments like microdermabrasion and other harsh exfoliants. So this is something, nanotechnology is something that they can do that can kind of really elevate their results and help to gently give them an alternative to other treatments. And so I do like to incorporate nanotechnology for somebody who does have mild to moderate rosacea. But if they do have severe rosacea and they are presenting with significant transepidermal water loss and their barrier is really compromised and they're feeling like they can't put on any product, even cleansing, flares them up, I'm not going to be working on them with rosacea. So it's really important when we look at these three things to kind of consider them individually and in terms of the condition itself. So, if the rosacea, for example, is really severe, we're not going to be able to work on it. However, if it's a little bit managed, if it's something that maybe they've been using a lot of home care, they've stopped drinking, and so they're not having as many flare-ups as they usually do, maybe we can start to incorporate nanotechnology for them. Some other skin conditions, right, when we have like a dermatitis, really probably not going to be working on that with nanotechnology. Some of the really dry skin conditions are pretty difficult as well. I don't work over eczema or psoriasis. Um, I just feel like the barrier is so compromised in that situation that I can't imagine how nanotechnology would improve those situations. Shauna, any thoughts on that? Yeah. And so,
I completely agree with that because any like small fissures or wounds in the skin, like it's just not a good idea. And if it's extreme, like even rosacea, the pustules and pastules, even if it's
right.
extreme, more advanced, this right, like you cannot go over that. That's like any modality, you don't want to work with that. But you're
We can
right
add-
about the dryness factor too. And if they I've gotten to a couple clients lately that are so dehydrated that their serums don't penetrate anyway. So the cell turnover is too low, and that, nothing in the cell is working properly. You can do it, but it's not going to be a benefit. So that's, I've had questions, not to get into open a can of worms, but the weight loss medications right now are really dehydrating people to the point of penetration is an issue. So, and it thins the skin. So I think, like you said, if it's that extreme in those dry skin conditions, that too is off the table. We
Yeah,
have to think if our modalities are going to be beneficial to our clients or not, not just something because we think we want to do it.
right, right.
You're right on all those accounts, Kelly. You know what you're doing, girl.
Like,
Sensitive skin can display way differently.
yeah.
Um,
And then there's other people that I can treat really well. So I have a very close friend. She has kidney disease. She was lucky
mhm.
enough to never have to go on dialysis, but she did get a
Oh,
transplant. Because of the transplant, she is on immunosuppressing
oh,
drugs, and she's also on photosensitizing drugs.
yes.
So and it's really a shame too, because in a lot of those situations, because she's on steroids, we have a little bit of hair growth that's excessive,
Mhm.
not a candidate, right, for any sort of laser or IPL because of that photosensitivity. We're not a candidate for LED because of that photosensitivity. So it's a shame because with conditions like that, a lot of the medicines that we're on are creating these cosmetic things that bother us that now we're then limited in what we're able to do for those
Mhm.
clients. So I am able to work on her with nanotechnology. She does really well. Her barrier isn't very compromised, thank God. But she is sensitive in terms of there's not a lot of actives, right, that I can use on her.
Right.
So when working with Hale and Hush, I can give her a beautiful facial with
Mhm.
nanotechnology that is going to manage that inflammation, that's going to help her with her brightness, because that's one thing that she likes to manage is her skin tone and the
Mhm.
evenness of her skin tone. And so we can really work to address that super comfortably and provide her with options because of the cause of her sensitive skin being a lot of the
Mhm.
drugs that she's on and her kidney
Medications.
function.
Mhm.
It's eliminates other things for her, but it does allow us to work with her with nanotechnology. And so the symptoms that she has don't interfere with our
Mhm.
treatment. The severity of her condition doesn't impact her skin so much that we aren't able to incorporate nanotechnology
Mhm.
and certain more gentle actives that are free of all those irritants. Because another thing with someone who is on these immunosuppressants is they're not really supposed to be healthy, which is something
Right.
a concept I really didn't even understand. So she's really never supposed to be at her best health because she will fight off that kidney. So it is just wild to me, but we really have to be mindful. And especially with her, which is another thing to consider, is what stage are people at? What is their current situation with an autoimmune disorder, with these drugs, with their cancer treatment? Because if she is at a time where she gets a lot of infections because her immune system is suppressed. So has she just been in the hospital? Has she had a round of antibiotics that are affecting her skin really significantly? So you did say we only have an hour, but it is.
Yeah, because that can go into so much more. But I do get questioned a lot if this can be used on autoimmune
Mhm.
issues or cancer patients. It can, but it all comes down to the health of their barrier and their skin and if it's beneficial. That's what it comes down to. Um,
Yeah,
I
absolutely.
think 80% of my clientele I can use this nanotechnology on and it doesn't bother them. What I think you're getting at in the considerations are that 10 to 20% of clients that this won't work
Right.
for. But at that point, no other modalities will probably work for them either. I mean, maybe
Exactly.
LED, right?
Right.
So,
Especially depending on, if they're on what kind of drugs they're on and their
yeah,
medical conditions. But yeah, definitely LED. Exactly. And then like we're
yep.
thinking about acne, because something you said earlier back about the rosacea and the grades, very similar with acne. We're not going to
Hmm.
be working on high grades of acne. So we are going to be able to help people who have a lower grade of acne. We can go around certain blemishes and things like that. But once we get into a higher grade of acne, we need to help manage that condition and get that barrier health back in order, get that inflammation and all of that down, get the bacteria managed if that's the cause. And then we can start to incorporate nanotechnology at a point where they're starting to heal, and now we can kind of prevent that. And I feel like that could be similar with other conditions as well. If they're having a flare up, if they're having something that's a super reactive moment, we're not going to be using Regenerate. But if we can get them to a point where their barrier is better managed and we can start to see an improve in the health of their skin, there is a potential to be able to incorporate Regenerate, especially to help kind of clear up, like when I think about acne, clear up some of that pigmentation that can be left behind, help to start to use a collagen, enhancing serum to maybe help to smooth out some of those scars and things like that. But for sure, in
Hmm.
that flare state, in that reactive state, it's best not to incorporate Regenerate because, and I think it is really gentle, like feeling. People ask us all the time, what does it feels like? Feels like a vibration. On the top of your
Yes.
forehead, you can kind of feel the tip a little bit, but it does feel like a tapping. It doesn't feel aggressive at all. So when we tell people like, hey, don't work out for 24 hours, they don't really believe us a lot of the time. So they'll go out and they'll work out and then they'll call me and they'll be like, oh my God, the sweat burned my skin and blah, blah, blah. And you really don't understand. Like a lot is happening when we're doing Regenerate, even though it feels very comfortable. It is
Mhm.
still, it's like a little overwhelming for the skin, right? And to the point where we're disrupting that barrier for a 20-minute period. So the skin has gone through a lot, has gone through a change, even though it tolerates it really well. And it's a great way to incorporate those ingredients if somebody misbehaves or if somebody is in a super reactive state. It's a lot more than we think it is, I guess is what I'm trying to say sometimes. It can really, I think sometimes people think, oh, it's just in the stratum corneum and, it's so gentle, we can do it on everybody. But even though it is really gentle, it's also powerful. And so definitely be very mindful of your protocols and really consider the cause, severity, and symptoms
Mhm.
of those conditions. We did get a couple questions in here. One about the
Yeah.
book practice in PA, which is a great question. I'm in PA, Rosemary. I use it. I've seen on the forums, some people have been having issues with it. I will see what the state board says when they come in, but it's only working within the stratum corneum, which is completely within our scope. There's no needles. It only has that 99% monocrystalline silicon, which is something else I think is important when we're working with people who have allergies or sensitivities. This doesn't contain any nickel. The 99% pureness of it really means that it is what it says it is. So a lot of times we get the question about nickel and about other allergens, and it is completely free of those. So another thing that's important to consider when we're working with sensitive skin. But I would just let them know, needle free, only working within the stratum corneum. Tell me what's illegal. Next question.
Okay.
Tell me.
Amanda wants to know how to market this treatment. Is it a series of treatments? And how often would you have them come in? And how quickly could we explain to clients that they will see and feel a difference?
So so it really depends on your area. It's so funny because Carlene, as you know, is oh, you answered it, but I have to still read it. I'm gonna go over to here.
Oh,
Um,
sorry, friend.
no, I got it. I just went over to answered. I just totally overreacted, Sean. I'm so sorry. How do you best market this treatment? Carlene and I, very close friends. She's in Houston and New York. I'm in PA, and we market them very differently. So it's a good question. I have mine, I charge by time. So this is something that I've moved on to. I do have a couple like pre-made facials on the menu, but I really don't want anyone to pick them. I just put them there for the people who won't book a timed facial, and I still want to get them in the door. But I prefer to book by time. So I have two 60-minute options and a 90-minute option. My first 60-minute option includes products and like ultrasonic spatula, cold therapy, ultrasound. That's it. And that's for 125. My next one is 165. I'll put Rezenerate in that, hydrodermabrasion, and some other
Mhm.
more advanced microcurrent, but they only get one within that time frame. So if they are want more, they have to go to the 90 minutes, and that's 195. So Carlene would say I'm cheap. Rude. That's what she wouldn't say it. She does. Her facials typically go 125 for her standard, and then she adds 100 on top for her Regenerate. So her Regenerate treatments start at 225. Neither of us market nanotechnology by going into the details of nanotechnology. We all just tell everyone that this is going to get them better results faster, super comfortable. So, and I think that's why it works for her as an upgrade because she's like, let me boost your treatment, let me get you the best delivery of all your ingredients. It's going to take the same amount of time and you're going to get better results. And especially if we're doing a treatment series, it's going to limit the number of treatments. It depends on the client whether I'm doing a series or one and done. A lot of my clients aren't working on like a specific condition. They're more like entering into the realm of my kids are just going to college and now I want to take care of myself. So they're kind of on like 4 to 6 weeks. So every 4 to 6 weeks they'll come in for their facial, and typically for a lot of them I will be doing Regenerate for them, basically based on their budget. Um, I'll offer a series of Regenerate if we are working on something specific. So right now I have a client who has pretty severe melasma and a lot of anti-aging clients. I always start everybody with a series of four. I tell them that that's just the beginning. It could be just the beginning. We're going to start out with four. We're going to evaluate you at four. After four, we're going to decide, do we need two more? Do we need four more? Do we need to go to monthly maintenance? But you're guaranteed to have four. With melasma, I'm sure she's going to be up to eight, and we can go beyond. It's breaking up pretty nicely, but we'll see. So
Well,
it
I
really,
charge more than you too, Kelly.
yeah, and everybody, I just opened in October and I came with no base of clientele. So I know that I'm low. I know that I'm low.
That's
And
fine. January 1st is coming up, girl.
I know, I know. So just gonna
I
build a
but I
scale.
you and I do treat by time. And I like that. And I think it's so much easier. So mine are 150 to 200 also for the res added in, but it could be anything else added in too. And I don't do treatment packages because my clients are all sensitive. So I never know from one appointment to the next if their skin's going to be able to handle it. So I don't offer like four in a row or those treatment packages. I think it's based on your clientele, based on where you live, based on the other things you can offer them also. Like some people, I had one lady that just doesn't like the feel of it.
Yeah.
Not to
Oh
bite
yeah.
on it, right? It just
Right.
it's fine. It does
Yeah.
not hurt. It's ridiculous. But one of our training teams, she does do big packages and she makes a great deal of money doing that. So I think it's all in who your client base is.
Yeah. So we got a couple more questions. How often would you have them come in? They can come in every 7 days if you're not doing exfoliation or if you're doing exfoliation every other treatment. Most people are not
Mhm.
going to come in every week. So if I'm working on a series, I like to get them to come in like 2 weeks,
Mhm.
every 2 weeks, which is pretty comfortable for them. But otherwise, like I said, my clients that are just maintenance. They're going to do every 4 to 6. And how do
Mm.
they explain to clients what they will see and feel? I give them that sponge analogy. So I let them know if it's going to feel pretty vibrational. Afterwards, a lot of clients describe it as like they feel like their skin can breathe or they feel like very plump and firm. It's different from client to client. I personally don't feel like my skin can breathe. I feel like more firm and plump, but other people have said my skin can breathe. So
Yeah.
I love that for them.
Kelly, I'm gonna run through my slides really
Yeah,
fast
because I'm taking too long. Yeah, go ahead.
because we have 8 minutes left. We
Mhm.
actually started a little bit late, but let me run through them. Some of them are slides that people have seen already, so we'll go fast through those. Share. Hmm. Okay. Oh, look, you have a great little intro slide Morgan made for us, right? So you guys will see the high res glide right here in this little bottle in the front of the little blue scrubbers. We do always recommend using that with any protocol we use with Rezenerate. So you guys do have to probably want that product too involved. And the little globes are so cute. You guys, you're gonna have to buy the whole package.
Everybody loves those globes. It's so ridiculous. You don't
It's
understand. People have come in. Like, I saw those globes on your social. Can I have them?
yeah, they just want the globes. Like, no, you need all of it. Yeah.
I'm like, yeah, of course you can have it. Of course.
Again, remember the importance of collaborations here and why we love to partner with people is because it's expanding your knowledge. It's helping you with the hierarchy of treatments, as Kelly just stated, a lot of different skin conditions and levels of health in the skin. It helps you create adaptive protocols for all your clients, gives them more choices and more effective results. And of course, finding a nation sensitive skin is always a big money maker. Our serums are used mostly in the protocols with Rezenerate. That is the big one. And of course, as Kelly said, exfoliants. I did not put our exfoliants in here, but if you're doing an entire protocol, as we've done many times with them, you want to use either the Incredible Enzymes or the Bedazzle Revitalize. However, remember, Bedazzle is spicy. She's a 3.5 pH, so just be careful when incorporating that in with any other serums. But these are the serums most likely used with the res unit. You know, Soothe Essence is our hyaluronic acid serum, which is what they've talked about. And we always place this on the skin. And then, of course, we put that high res glide on top to use the device. So remember, you're locking in any serum under the high res solution. So Soothe Essence is great for barrier repair. It's great for hydration and really just reducing inflammation and redness in the skin. And then our Rare C serum is probably the one that's used the most with this device. I think lots of our protocols have this, and at trade shows when we do demos together, I think we use this most often. So Rare C, of course, does all of the great things vitamin C does. It helps with lightening and brightening and general skin health. This formulation is 7 to 8% L-ascorbic acid. So it does have an ingredient that helps with visibly reducing the pore size, which a lot of clients do complain about that, and that's one of their issues. So this is where I like to use this serum. But it also reduces fine lines and wrinkles, helps with collagen and elastin building. And they can use this prior to treatment, obviously during treatment, and then after treatment, which makes it a great serum to use and then again retail as home care. And then this one's is a little spicy too, our rare mandelic, even though it only has 8% mandelic in it. It can be spicy to some skin types, right? I love to infuse this with the acne clients, grades 1 and 2. This really does help with skin retexturing, helps lighten pigmentation, and even light scarring. I'm not saying the big pitted scarring and, you know, those really deep scars into the skin tissue. But man, if they're light and just scarring PIE, PIH, This Mandelic Serum is awesome for that. And again, not only used in treatment, but can also be sold retail for home care to use prior to treatment again and then after treatment. So I do love to use the Rare Mandelic. We can't use it at all of our demos and things like that because it is a little more spicy to the skin. But if their barrier is healthy, this is great for them. Like Kelly said, I'd be more careful on grades 3 and 4 acne, of course, and same with this Mandelic Serum. So I would just be careful on that.
And I would also say, Shauna, of course, nanotechnology isn't really going to stimulate any hyperpigmentation, but I
Mhm.
do like to have my clients who are prone to PIE or PIH on something like a Mandelic or a tyrosinase inhibitor 2 weeks before, just all the time, really, before I
Yep.
incorporate any device,
Yep.
including nanotechnology.
Like just in their everyday home
Hmm.
care treatment, if they should have it.
Exactly. Sorry, go ahead.
This protocol is the last one we did with Rezenerate. We've had probably 4 or 5, either on the website. I'm gonna stick this in the Airtable for you guys who have the link. It's also available on our Facebook Pros group to download. And then I think, don't you have it too, Kelly, on your
Yeah,
website?
so for
Okay.
owners, if they go into their owner portal, it's in the
Mhm.
skincare protocols folder.
Okay. Perfect. So you can get this multiple places. This is the one we did for neck and décolleté. This one we did use the bedazzle because we were trying to get this mature skin nice and lighten and brighten in the trouble areas, especially on the décolleté. So we combined this one. This one we did use the Rare Mandelic and then of course our Berry Boost mask. So as you can see, you can incorporate most of our products, all of them actually, into a treatment protocol with the Regenerate device. However, make sure you also have that Res Glide. I think that Res Glide really does help a lot. So
Mm.
definitely the nano brushes, you can use theirs, you can use ours. And then of course, globes of some kind. Kelly has a super cool trick where she puts the globe sitting in ice water while she's doing the other parts of the treatment. I thought that was awesome. You could also put them in warm water if you wanted them warm on the skin too, for more relaxing treatment for some muscular structure. But you guys can find our protocols in all these cool places. Our free education continues. Next month is the Team Awesome and our holiday strategies, which is always fun and exciting. Melissa and Victoria will probably take over that one a little bit because they are our top retailers of our team. And then October, we're going to talk about peels with Linder Health. And then November, we'll talk about diversity in the treatment room with the Fearless Beauties Advanced Spectrum Advanced Aesthetic School. All this stuff can be found. Here's your Airtable. If you don't have the Airtable link, get that QR code or email me and I'll get it to you. I'm going to upload it right after we're done. I'll upload that protocol in there and probably the other ones too. I think there's 3 other ones. So, and then you guys know how to reach out to me. That was super easy, right?
Yeah, that was
Try to
really
go
easy.
fast, Kelly, because they just want their prizes. You know, they don't really want to listen to me. So,
I don't believe that's true.
okay.
I love listening to
All
you.
right. Did we answer questions? There's more, Kelly. Isn't
There's
there
more.
more?
There's more. I did type in some. We did get
Okay.
Kelly asked, "What do you do if they have a reaction?" I actually tell them to discontinue all their products except for Quiet Wash, and really whichever
Mhm.
moisturizer is best for them. And of course, if they want to include the relief bio powder, they could do that as well. But
Mhm.
really, all their actives out the door for at least 4 to 7 days or until that reaction is managed. And I also like them to ice their skin, depending on with like a lot of times too, they'll be like they get really red from working out or sweating. The sweat will burn within that 24 hours. So I like to tell them to wash their face, and then they can cool their skin for up to 10 minutes a few times a day. But definitely get rid of all those actives. And if there's a more occlusive moisturizer, which one's most occlusive? It's not the saffron. It
The saffron.
is the saffron.
It's the saffron. Good
Yep.
job.
I
Or
didn't think
they
I was
can
right.
use the Remedy Rehab too to calm the skin. They can use the
Oh yeah,
oil if they
Remedy Rehab.
dry.
That's a good
People
one.
have different reactions. Some of them feel
Exactly.
dry. I've had someone feel kind of sunburn, which is the inflammation. You know, they complain about different things. It's
I
so
do. They do.
funny.
You're right. And then we did got a question from Jennifer, which was if we're just using hyaluronic acid, how do we treat those other conditions? You can use much more than hyaluronic acid. You can get super creative with your protocols. In the protocol that Shauna was mentioning, we do use the rare Mandelic serum. The only time I would use just hyaluronic acid is if you were working conservatively with a sensitive client and you're starting to incorporate Regenerate, then maybe you want to limit the serums. But otherwise, you can use your expertise to incorporate any sort of those optimal choice serums, which are like peptides, growth factors, HAs, postbiotics, prebiotics, probiotics, and tyrosinase inhibitors, any of the things that really don't give a lot of sensation to the skin when applied alone, don't have an acid content, and also feel, nice. Don't feel burny when the client applies it to the skin. If a client has keloids, can I do this? I always dance on this question. I would say no, yeah, especially depending on the severity. Has it been done? Yes. Has somebody survived and not had a keloid? Yes, but it's person to person and it's a risk. It's a risk. And
It's a
especially if
big risk.
you're doing the face, I don't like to
Mm,
take risks on the face. Um,
mm-mm.
how many sessions should we provide before offering this service? Could it be used as a first session on a healthy barrier? Yes.
Yes.
And especially if a client comes in and I always ask them what are their past services that they've had. If they're like, yeah, I've had microneedling, yeah, I've had a bunch of chemical peels, and they seem pretty resilient, their barrier's
Mm,
healthy, I will incorporate it, especially with the Hale and Hush protocol. Because I know, right, that there's not going to be any allergens and, well, not necessarily, you know what I mean. How to clean and sanitize nano cleansers. I wash them like physically with a antibacterial soap. Then I
yep.
use a alcohol wipe, and then I put them in my UV cavity. Can you purchase the Glide by itself through Hale and Hush? No, but you can purchase the Glide by itself through Regenerate, even if you don't have a Regenerate. I
Mm,
don't offer this service yet. What hyaluronic acid should I get? The device
mhm.
does come with a hyaluronic acid. It's a 65% clinical grade with just phenoxyethanol and water in there. It's an excellent glide. So you can absolutely use that. If you wanted to use another hyaluronic acid, I would say look at the ingredient list, make sure there's nothing sneaking in there. And then
Mhm.
the other thing I would say is it's better if it can have a variable molecular weight, but it should have at least a little bit of a higher molecular weight HA in there so it sits on the surface because you want it present as a glide. So if it absorbs super quickly, it's not an ideal hyaluronic for the treatment. And I
Yeah.
think that was all the questions.
It was. We got to give this away because we're obviously over time, because we always are. So,
Oh,
Morgan,
good.
do you have your spinner?
I
We're going to give
sure.
away all three of the serums, the Mandelic, the Rare C, and the Soothescent. And of course, the Berry Boost Mask. And then we're going to throw in an Incredible Enzymes because that is all part of the protocol. Most of them, we don't want to do too crazy on the Bedazzle. Should we do the Bedazzle instead? That's the protocol.
Instead of what?
Yeah, let's do it. We'll do Bedazzle
Instead of what?
instead of Incredible.
Oh,
So we need 5. Who wins
Somebody
the
did
Mandelic
ask
serum?
about the protocol I used on my friend, and I did use the Incredible on her.
Okay.
this is for the Mandelic. Please let the sound work.
Oh, it is. Remember, let us know that you're here in the chat, and then you'll have
Alona?
to. Alona, are you in here? He is. Okay.
Perfect.
You have to email education@haleandhush.com for your prize. Make sure you send me your address. Can't type today. I need your shipping address and your full name. Okay, Racy.
Francesca.
Are you in here, Francesca? Yay, congratulations. Okay, what about Morgan? Let's do Soothescence.
Okay. Marianne Pepper.
Hey, Marianne. I always put an E on her name. Congratulations, Marianne. Are you in here still? Yeah, okay, girl. And then what about the Berry Boost mask? Who's the lucky winner of that?
Therese Fellner.
You there too.
Is Therese in here? Therese? Uh-oh. Hold on. Get to your chat, girl.
I know, sometimes it's hard.
I know. Therese, are you still in here? We're going to have to spin again.
Amanda, I didn't know you could hear my keyboard.
Oh yeah,
Yes, we
it's so
can.
cute.
It's so loud. Okay, we'll go on to the Bedazzle and we'll give her a minute. And
back.
if she doesn't answer, we'll come back.
I don't see her
Okay.
name in the attendee list.
Oh, she
Maybe
left?
she left.
I don't see her in there.
Womp womp. Heidi Goldstein.
Heidi in here?
Heidi, please don't let me down
Yay.
twice.
Heidi's here.
Oh,
Hey!
don't let me down twice. Okay,
Okay.
Therese, last chance. Don't forget, email me your shipping address. I don't have access to it.
Therese is not in
All
here.
right.
So who's getting the berry boost?
Go back. Do it again.
Kim Stevens.
Kim volunteered. What a nice.
I'm asking if it lands on Kim Stevens right now.
What an awesome
I would
offer.
die.
Maya Jamie. Are you in here?
Maya, are you in here? Because Kim's ready to take it.
Don't give me 3 strikes, Maya. She's
Yeah.
here.
Sorry, Kim. That's funny though. I appreciate it. Okay, you guys, there's our 5 winners. Always a good time in these webinars. I hope you guys learned a little bit today about nano infusion with sensitive skin. It's one of our favorite treatments to offer. It's one of our favorite protocols, one of our favorite companies to work with. So we hope that you guys love it too. Any questions about Rezenerate, Kelly? How can they contact you?
Kelly at rezenerate.com. I'll put it in the chat. And I did answer the question about what the system comes with in the chat as well.
I already got it, Kelly.
Oh, okay.
Oh, you did.
You type faster when you have a
A
chunky
good keyboard. Oh my God, let's see it. Let's see it.
Yes, Rebecca. The recording will come
it is
24
beautiful.
hours from Zoom.
Okay.
Actually, yeah, you'll get the recording from Zoom, and then this replay already has to go up on the YouTube like today because I need it in the newsletter, so it'll be on YouTube fast as well.
Great.
Oh, there you go. That's awesome.
Double whammy. Thank
Everyone
you, Megan.
loves the keyboard. You guys should be in an hour-long meeting with the keyboard. Then you'll be like, Morgan, turn your keyboard.
This is literally
Jamie for
what
her
you'll
keyboard.
hear. This is what everyone hears.
I don't know. Jaylene's is the same. I get really. Hers sounds different though. I like the sound of yours better.
Thank you. It's very
Well, this
thick.
will be on YouTube, so she can hear it.
Oh, well.
I complain
Jaylene's
about it all the
stupid.
time, so she knows.
I actually do keyboard ASMR. No, I'm just kidding.
I'm like, what is the channel? I love it. Oh, Lynn didn't see what it comes with. So the device is gonna come with, it comes with the device itself. The battery lasts for 8 hours of use, so a really long time, but there is a charging cord that comes with it and you can use it plugged in if you needed to. So it comes with the device, the charging cord, the carry case, 1 ounce high-res glide, the set of the nano globes, 2 of the nano cleansers, 20 tips, lifetime warranty on the device and the nano cleansers, and full training and online certification, and a bag and brochures. And I think
There
that's
you go, Kelly. Cut and paste that thing right back.
There you go. Let's make sure it was comprehensive. 20 tips. It looks like it is. Looks like it is. Guys,
I'm
it's
Megan.
worth
I'm
it. I
smiling.
love it. What'd you say?
Megan told me to smile, but I can't smile when I'm concentrating on doing things. Uh-oh.
The device is on sale for August for $7.99, normally $1,100.
I like how Megan caught me taking a picture.
Megan caught you.
Okay, ready?
That's
Smile
why.
for me, Kelly. Thanks.
Oh, that's what Megan was telling me, like to smile during the picture. Got it.
I didn't get it either. I was like, is she just
No,
showing
I
me?
was being sneaky.
I know. I didn't feel like. Okay, well, our webinar is over. Right. Thank you, Kelly, so much
Thank
for
you.
stepping in and teaching us all about the nano infusion. I think it's a lot of things that people don't know. I think a lot of words are thrown around about needling, channeling, infusing, and this just clarifies what's possible with sensitive skin. So I hope you guys enjoyed it, and I hope you learned something. And reach out to either one of us if you have any questions.
Yes,
Okay?
I hope to hear
Kelly,
from you
thank you
guys.
so much.
Thank you.
I'll miss you now. I won't see you for a while.
I know. Let's not talk about it. I'm already.
Okay. All right. All right.
Okay. All
I
right.
still love you though. All right. Everyone,
My
thanks for joining.
email again, one more time, was Kelly
Yes.
at Rezenerate. Pop it in there. Here it. It's up.
Oh, typo, but you guys know what I meant.
Not Coim, but
Not
very
Coim.
close.
That's
Okay.
Coim.
That's what happens when you.
That's what happens when you have nails and clickies and did my
All
best.
right.
Peace
All
out.
right. Bye,
Okay, you
guys.
guys. Thank you so much. Love you, Kelly.
Bye,
Thank you.
Kelly.
Bye.